The future to come in 20 to 30 years. Can it be predicted in the times of global uncertainty? How to map out the contours of the future so that they are more clear and bright. And what can be done by those who are today called the new generation?
Sometimes my friends joke, your father is a surgeon, your mother is a cardiologist, and I connected these two specializations and became a cardiac surgeon. This is probably the case.
Rustem Toleutayev, a cardiac surgeon, the author of over 30 scientific publications, completed a medical university program and clinical residency in Russia in the city of Novosibirsk. Also completed an internship in Italy at the Bergamo Clinic and a master's program at the University Milano Bicocca. At the moment heads the cardiac surgery department of the Sysganov National Scientific Center of Surgery.
My father, Mukhtar Toleutayev, is a surgeon and he works at the Oncology Center in Astana. My mother, Gulnara Toleutayeva, is a cardiologist in a prestigious clinic in the capital. My wife also comes from a family of doctors. Her father is a surgeon. She is very familiar with the specifics of the field of surgery and therefore does not require any explanations about it. Quite often I come home late. If there is a complicated surgery, then sometimes I come back only early in the morning. In these moments, she understands everything and always supports me. I finished the medical university in Novosibirsk. I underwent an internship training in general surgery. Got accepted to the residency of the Mishalkin Scientific Research Institute of Circulation Pathology. I chose the specialization of cardiac surgery. In Novosibirsk, I worked under the leadership of a reputable Russian heart surgeon, Alexei Karaskov. He is the director of the institute and I consider him to be my mentor. After 3 to 4 years of working in Novosibirsk, I got the feeling there is something missing for me. Professional experience in Russia is of course great, but what to do next? What to focus on? At that time, doctors from Europe came to Novosibirsk, and while speaking with them, I decided that I wanted to go to Europe and see how professional specialists work there and to get new experience. Italy gives out 5 to 6 grants annually. Thanks to this grant program, I got the opportunity to complete a master's program in the university in Milan. And at the same time, I was doing an internship at the clinic of a cardiac surgery center. Professor Firazi became my mentor. By the way, there are only 2 cardiac surgeons in Italy which do heart transplant surgeries, and Paolo Ferrazzi is one of them. When my internship ended, the professor asked me whether I would like to stay there. In either case, he was ready to support me. I figured, Russia is close to Kazakhstan, where the people close to me live, and Italy is far. That is why I made the decision to return to Russia. I came back to Novosibirsk and continued my work at the Mishalkin Science and Research Institute. This was a great educational environment for me. I worked as a cardiac surgeon there for 8 years.
Қазір ойласам, жалпы көрші елдерде кардиохирург болып 8 жыл еңбек еткен екенмін.
In 2015, I got an offer in Kazakhstan to head the cardiac surgery department at the Sizganov Scientific Surgery Center, which is located in Almaty. I didn't just agree, but was incredibly happy, because regardless of where I studied and worked, I secretly wished to share the knowledge and experience that I gained back in my home country.
Италияда, Ресейде жүріп
Everything that we learned in Italy, Russia, and Germany, I and my colleagues are today implementing in practice at the Sizganov Center, including the transfer of new technologies, minimally invasive cardiac surgery, using the thoracoscopic method to remedy cardiac arrhythmia, treatment of hypertrophic cardiomyopathy, and use of a hybrid method to treat congenital heart defects. Technological development is quite rapid these days, including the field of medicine. This especially concerns cardiac surgery. New equipment creates new opportunities. New technologies are developed which allow to perform the most complex surgeries.
Адамның ағзасына жете алмайтын жерлері болса, о жерге жаңағы құралдарды қолданып жетуге болады.
For example, 90% of the equipment used at the cardiac surgery department of the Sizganov Science and Research Institute is of the latest generation. I have a small collection of artificial heart valves. They can already be considered as museum showpieces because they are already outdated and have been replaced by new ones.
Сондай бір коллекция жасағам. Мына клапанды алғанда бір өзімізде науқас болды, өте күрделі науқас. Жаңағы жас болса да, кезінде кішкентай бала кезінде осылай клапанын ауыстырғанда 15 жыл жүрген сол клапан. Былай генерацияларын қарасақ протездердің
For example, the first generation of artificial valves from Star Edwards had been replaced by mechanical ones. Then there was the third generation, bilateral artificial valves, which we use today.
Қазіргі қойылатын екі жармалы протездер.
Жүрек алмастыру
Today, nobody is surprised that it is possible to implant an artificial heart or perform a surgery without opening up the chest cavity.
ешкімге таң емес. Қазір өмір ағымы адамдардың
Modern life forces people to become more mobile. This pace of life can often be stressful for many people. At the same time, we neglect our health and the fact that we have to take care of our heart. This especially concerns the young generation.
Вот здесь тень протеза. Это видишь? Вот это вот протез. Қазақстанда ғана емес, бүкіл әлемде.
Coronary artery disease today is the most widespread disease in Kazakhstan and other countries of the world. In second place are other chronic heart diseases.
Больно или просто?
Боли нету, звук вот такой стал.
According to global statistics, 1 out of every 1,000 child is born with a congenital heart disease. And overall, from around 8 to 14% of children worldwide suffer from serious problems in the functioning of their cardiovascular system. When it is determined that these very young patients require surgical intervention, it is usually postponed until they are a bit older. At the same time, they have to be under constant watch of a healthcare practitioner.
Қазақстанның облыстарына барып, облыстың ауылдарына барып.
My colleagues and I have to often visit different regions of Kazakhstan and provide consultations to the local specialist. We conduct master classes and give lectures, which is also part of our work.
Консультация жасап, мастер-класс жасап, лекция оқып, сондайда жұмыс істейміз.
Два пинцета коронарных.
Вот она.
Будем выделять? Да, вот она.
We have a very busy work schedule. Every minute is accounted for. I have to do the patient rounds in order to stay updated on their condition.
Олардың жағдайын білуім керек.
In order to resolve pressing work-related problems, it is also necessary to make time for personal communication with the medical personnel of the department. And then there are appointments and consultations with the patients of the center. So overall, if there is no emergency, this is the everyday work schedule.
Шұғыл шаруа шығып қалған жағдайда болмаса, жұмыс кестеміз өзгермейді.
Кардиохирургия оталары бір 4 сағаттай.
Heart surgery on average takes 4 hours to perform. Difficult surgeries take 6 to 8 hours. Sometimes we're in the surgery room for 24 hours, so we're on our feet the entire day. Therefore, the work of a surgeon entails incredible physical exertion.
Жүктемелер көп болады.
Работаем.
I have 3 children. When I ask them what they would like to be when they grow up, they answer in unison: doctors. And I tell them that they should really think about this. The profession of a doctor is difficult and entails great responsibility. A close friend of mine with whom I studied at the university and lived together in the dormitory is a professional level swimmer. He got the candidate master of sports certificate in Russia. I taught him how to freestyle wrestle and he taught me how to swim. So now we go to the swimming pool together. A cardiac surgeon who doesn't do sports will not be able to handle such an intense work schedule. Physical activity gets rid of fatigue and energizes. Overall, I think that in order to be able to keep up with the trends, one needs to be a person of many talents, be social, and expand one's circle of friends. I consider myself to be a lucky person. Throughout my life, I've only met interesting and independent people. In school, at university, at the medical center, everywhere I was always surrounded by good and strong mentors. My life experience has taught me that the main factor for the new generation is not age, but the ability to adapt to global changes and readiness to make use of the world's best practices.
Жетістіктерін бойына сіңіру, жаңа дәуірдің жағымды жақтарын тап басып тану, оны кәдеге жарату.
Жаңағы науқасқа біз
We have performed heart surgery. We've restored the heart artery's blood flow by bypassing the narrow place of the coronary artery. Now the blood flow is normal. It's meant to prevent a heart attack. For example, I must always keep up to date on which innovations can today be introduced in the field of cardiac surgery. What is required for this? To be proficient in English so as to be able to find information online. This way I can find all the latest and most useful information for my work.
Үйренуге, ізденуге жетелейді.
Rustem Toleutayev is dreaming of introducing the method of heart transplantology at the Sysganov National Scientific Center of Surgery. By the way, his colleagues in Astana are already familiar with this method. In addition, he would like to gather the world's best cardiac surgeons in Almaty within the framework of an international conference. Hence, there's plenty towards which to strive and goals to achieve.